Welcome to 10 Times Healthier with DrMuraHealth podcast. Join us as we welcome Dr. Nyasha Grace Gogoma, the Interim Executive President of the South African Lifestyle Medicine Association, Salma.
What is lifestyle medicine?
Thank you so much, Dr. Ernest. Well, lifestyle medicine is...
Dr. Gogoma uses her expertise to empower individuals with practical, life-changing health strategies.
So what I found is that patients are actually very interested in lifestyle change.
Right.
Everybody wants to be able to manage the conditions without having to take pills, right? Because a lot of people actually are burdened by the number of pills they have to take.
Today, she shares revolutionary insights that bridge medical science with everyday wellness.
How are you finding it, especially when talking to patients about the lifestyle change and how is it going?
Dive into a conversation that transforms how we view health and paves the way for a vibrant future.
What actually scared me into action was when I went to the doctor and I found out that my blood pressure had actually increased. So my blood pressure, in South African terms, it would be classified as pre-hypertensive.
Who's Dr. Nyasha and how did you end up becoming doctor?
Okay, well, as you said, my name is Nyasha Grace Gogoma. So
Don't miss this enlightening journey with Dr. Nyasha Grace Gogoma on 10 Times Healthier podcast.
Dr. Nyasha, we are going to be talking about how lifestyle medicine has actually transformed your life. But for some people that are just tuning in right now, why should they stop and listen to the rest of the conversation? Why does it matter? And what is lifestyle medicine?
thank you so much, Dr. Ernest. Well, lifestyle medicine is probably the single most important field of medicine right now, simply because most of the interventions are free and they have the potential to make a huge impact in patients' lives. So lifestyle medicine is a fairly recent field in medicine. It's been around since 2004, so I guess 20 years old now. So it basically consists of 6 tenets or principles. So the first being a plant-predominant whole food diet, physical activity, stress management, avoidance of risky substances, restorative sleep, and positive social connection. So if patients are able to change their lifestyles and do all of these things together, then not only can they prevent chronic diseases, but they can treat and actually reverse some of their chronic conditions.
That's interesting, and like you said, these interventions are actually simple, hence the lifestyle medicine. But don't you find it somehow very, very difficult? We are used to getting a prescription for anything, and especially when patients come to see you, if you don't give them a specific drug and tell them how they can change their lifestyle, that may not necessarily go well. How are you finding it, especially when talking to patients about the lifestyle change, and how is it going?
Thank you, Ernest. Well, I think there's 2 aspects. So what I found is that patients are actually very interested in lifestyle change.
Right.
Everybody wants to be able to manage the conditions without having to take pills, right? Because a lot of people actually are burdened by the number of pills they have to take.
Yeah.
But I do find that there is some resistance when they realize perhaps just how much they have to change their lifestyles in order to see dramatic results.
Yeah.
However, we know from the evidence that even modest changes in lifestyle can confer some health benefits. So I would say start from where you are, start small.
Yeah. Anyway, before we dive into this, I want to know who are you? Who's Dr. Nyasha, and how did you end up becoming a doctor?
How I ended up becoming a doctor? Wow. Taking me back to so many years ago.
Yeah.
Okay, well, as you said, my name is Nyasha Grace Gogoma. So basically, I'm Zimbabwean. I was born in Zimbabwe, and then my family moved to Botswana around 2005 when things started going downhill in Zimbabwe economically. So then pretty much grew up in Botswana, and then I came to South Africa to study medicine. So I actually studied at Wits.
Right.
So basically, ever since I was a child, I think I always wanted to become a doctor. That was the one goal that I had in my brain. Of course, when I was a little bit younger, I think I wanted to be an astronaut, but then I grew up and realized, maybe not. But otherwise, I've always wanted to be a doctor. I just really enjoyed helping people and, just helping people to change their lives. So, yeah.
No, that's good. And now, as a young medical graduate, passionate about finding the holistic approach to healthcare, What then inspired you to specialize in lifestyle medicine?
Well, in my clinical years in medicine, so that's third to sixth year at vets,
Right.
we were exposed to disciplines such as family medicine and public health. And I realized that I was always very drawn to both those
Right.
disciplines simply because of the preventative care nature of the work, as well as the primary care nature of the work. I loved the idea of helping somebody, of sort of being the first person that somebody sees, and
Yeah.
then possibly helping them to change their life so that they wouldn't need to go on to
Yes.
more advanced levels of care, such as hospitals or things like that. But I really enjoyed that. But when I was in medical school, to be honest, I'd never heard the term lifestyle medicine used in that manner. It was only after I graduated, actually, when the former president of the South African Lifestyle Medicine Association, who incidentally is also one of my classmates from med school, she posted in our WhatsApp group. So we have a
Right.
WhatsApp group from med school that we still are active on to this day. And she posted, I think it was one of the webinars or something about join Salma,
Yes.
become a member. And I clicked on it, and I went on the website and I was like, oh, lifestyle medicine. This is very interesting. This is literally almost everything that I believe in. So
Yeah.
yeah, it was just it just grew
Yeah.
from there.
Yeah. And you're right. I mean, these lifestyle medicine, like you talk about, something the patient can do, and not necessarily have to undergo certain procedures. Often when people see the advancement in medicine and technology that we have, in surgeries, people sometimes they find a comfort that, you know what, I'm gonna get it fixed. But if the more we talk about this, they have to understand, actually, even if you're going to have that surgery, you are better off not needing that surgery, because once you have to go that surgery, there are complications, the infection, it's a little bit difficult to get the body back to what it used to be.
Absolutely.
And hence the lifestyle change is actually better. Anyway, so talking about of course, you just learn about the lifestyle medicine. So it's very sad at a medical school, you never really heard that name, that word, even in my medical school time as well. I mean, talking about like lifestyle diseases, like diabetes, hypertension. Of course, we will say lifestyle change is the first line.
Exactly.
But often no one knew what that is.
Exactly. No one knows what it entails.
No one knows what that entails. And probably say, okay, we're going to send you to the dietitian or whatever. And because even the doctors not knowing what it is, eventually it's not gonna really happen. If the patient comes back next time, nothing would have happened, and immediately so we started medication, and that's how the things have been. Anyway, but has it been? Of course, I understand that a pivotal moment where you find, what your colleague have put, and then you learn more about lifestyle medicine. But any health problem or some challenges that probably would have influence your desire and belief in lifestyle medicine?
Yes, so I actually have a personal testimony.
Right.
So around 2002, okay, so actually, going back, so I graduated med school from vets in 2019.
Right.
And then I went back to Botswana to complete 1 year of internship, and then I was working as a general practitioner in private practice for about a year after that.
Okay.
So then that would have taken me to about 2022. So I actually got married early in 2022.
Right.
And then shortly after that, I decided to quit my GP job and then move back to South Africa to be with my husband permanently. So somewhere between, not having an active job, being sedentary, staying at home,
right,
not doing any physical activity, enjoying all the amazing food that my husband was providing for us. Yeah. So somewhere between all of that, I just gained like 10 kgs of weight. And I mean, growing up, I'd always been somebody who had a fairly healthy appetite, but I never actually managed to gain weight. So
that
because
development, you're eating probably health food.
Yeah, but I don't know if it was metabolism or maybe I was more active then, but I don't know. So having gained all that weight was quite a shock for me. But I still wasn't that upset about the weight gain. What actually scared me into action was when I went to the doctor and I found out that my blood pressure had actually increased. So my blood pressure, in South African terms, it would be classified as pre-hypertensive.
Right.
So in the around 130s over high 80s. But according to the American Association. That's actually stage 1 hypertension.
Now there's a new definition.
Yeah,
actually,
yeah. So I was like, absolutely not.
yeah.
So then that's how I decided to. And so actually that was around the same time as well that I found Salma and found lifestyle medicine. So I was like, you know what? Let me use these principles and see if I can't, change my life. Yeah. So I went on the diet. I completely changed my diet. So I was eating predominantly plant-based diet. Stopped drinking sugary beverages. Stopped eating processed foods. And the thing is, so obviously to be able to lose weight, you need to have a caloric deficit. And the thing is with a whole food plant-based diet, I found I was actually able to eat a lot of food and be full, but then still because I was using my Samsung Health app at the time to track my food intake each day. I wasn't counting calories, but I'd find whenever I record what I've eaten. At the end of the day, I've actually eaten probably 1,200 calories. So it was like less, but I was full. I wasn't starving or anything. I was eating when I wanted to. So I was able to get a caloric deficit and actually lose weight, and also started exercising. I started with doing just hits. I was watching YouTube videos at home because why pay for gym if you can do it from home? So I was watching dance videos on YouTube. At first I started with walking because the dancing was a bit too hectic. So it was just like walking, hits, cardio, and then I did that 3 days a week and increased to 5 days a week. And so I started with hits. Obviously aerobic exercise helps to lose more weight. And then as the months went by, I started incorporating resistance as well. And currently I do mainly resistance. So
no, that's incredible, because often as especially in medical communities, as young doctors, I understand you were actually home, that's why you started gaining weight, but even people at work were getting more weight because we don't have the time to actually prepare, healthier foods, and people live on takeaways. And I mean, when you see some people that you were together in medical school, and then you separate, you go into internship or community service. Later on, in a couple of 5 years, when you meet them, it's like you cannot recognize them. They have it quadruple their weight. So this is really reality what's happening. But how much weight did you manage to lose, and in how much time?
So I actually managed to lose all the weight. So my goal was actually to lose 10 kg. So to go from 71 kg, which was my beginning weight, back to my weight gain weight, which is around 61 kgs. So I actually managed to lose weight, and actually ended up overshooting slightly. I think it ended up at one point being 59, 60, but that's around where I am now.
And the beauty of
sorry, this was over a 6-month period. So I took it really slowly. I wasn't looking for a quick solution.
Definitely. And often when all these kind of health burdens, health ills that we put on ourselves, when you look back, they didn't come in 1 day or 2 days.
Exactly.
Just when you realize, oh my goodness, I'm in danger. I want to take it out immediately, which is not how it is. So when you start doing the right things, and that's what I often tell my patients, is that don't forget, let's not focus on weight. They focus on getting things right. And I also explain how the healing starts with inside. And often, of course, we talk about the weight that we see outside, and few people consider what is going on in their organs, and what is going on at the endothelial level in their vessels. And the good news is that it started taking place. The healing started taking place, even not necessarily having lost so much weight. And that's a very incredible story. And I like how you mentioned how you were actually eating more, but still, because most plant-based food or most healthier options, they are calorie dilute. I mean, they are full of water, basically. Plants are full of water, no matter how you eat. And also the beauty of fiber. That's how actually eliminating and diluting the calories that are going to be absorbed, and also making your gut even healthier. So that's actually an incredible story. And did your husband what did your husband say?
Well, I mean, I think he was encouraging for me, but for adopting it personally, he wasn't that he wasn't that into it. But I mean, at the end of the day, it's like I was ready to change. I was like so determined because I literally remember that I went to the doctor one day when I was at the beginning of this journey. I was like, okay, I'm gonna go to the doctor. I'm going to check all my blood work, get my UNE done, my FBC, check how much is my cholesterol, and then literally the next day, that's when I started the program. So I was ready. So I was like, I can't really expect my husband to be,
of course,
as determined as me, because probably he hasn't had the same time, and he's not at the same level of readiness of change as I was. So yeah.
But you're going to be the force of change. I mean, you start preparing these meals.
Yes, and I do. Yeah, no choice but to eat them.
So it's actually incredible. So, of course, then after that, you delve deeper into this field of lifestyle medicine. But I can imagine there may have been some misconception that you find among our peers, such as, lifestyle medicine approach cannot be that effective like traditional medicine. What are other main misconceptions that you find within our peers when it comes to lifestyle medicine?
So, as I said, lifestyle medicine, it's a fairly emerging field of medicine. It's only been around for 20 years, whereas most of the other ones have been around for at least 100 years or even longer.
Yeah.
So perhaps people, one, they haven't even heard of it, a lot of them. And then the ones that have are a bit skeptical because it seems that the things that we tend to push and believe in kind of seem adjacent to, non-conventional fields of medicine that perhaps don't have the same evidence base. But one thing that I would just want to stress is that lifestyle medicine is actually a field of conventional medicine. So we're an evidence-based field. We use scientific evidence. So there's clinical trials, systematic reviews, meta-analyses, the highest level of scientific evidence that's available here.
Yeah, and that's very important to mention. Thank you for mentioning that, because it's just this is evidence based. To be a lifestyle medicine practitioner, primarily, of course, you have to be a lifestyle. You have to be a doctor. You have to be a physician. You need to go through, medical school. And lifestyle medicine is not a it's building up on the core knowledge, the physiology, the anatomy, pathology, and all kind of things. But now we know better when it comes to the pharmacology. We say, hey, yes, we do have certain medication that do save life, which is great. But hey, there is another way. This medication invariably does come with some side effects.
Exactly.
But if you change your lifestyle, you don't have necessary to undergo these side effects.
Yeah.
Hence, I believe, I think one of my favorite lifestyle medicine doctor, Michael Greger, saying that if this lifestyle change can do all these things, talk about heart disease, diabetes, hypertension, shouldn't this be the lifestyle of default? Can you just start with this before anything else? Because no one is going to be harmed necessarily by adopting this, but the only side effects will be people to actually get it more better.
Exactly.
Yeah.
Exactly.
So that's how I like this. So when it comes to of course, whatever misconceptions that are there, of course, people need to be referred to the scientific research. And I think often doctors, we're so busy to be able to go to peruse, to understand the latest research. But also there's a competition, you're competing with so many other pharmaceutical industries who literally do also write their own reviews, some papers. We know how some research may be skewed in a certain way.
Yes.
So, but one have to be really a student again to learn about this. But evidence are there. And the same we talk about how it is on about 20 years or so. But evidence has been there. I remember, for example, talk about heart disease in the US. It's number one killer. But we know, I think Dean Ornish demonstrated how how a heart disease shouldn't take a place to start with. We're talking about coronary artery disease. But if it happened, it can actually be adequately reversed. That has been more than 30 years ago.
Yeah.
So they have been, of course, they are pioneer in lifestyle medicine. Some even call it preventative medicine. But I think the the formal school of the College of Lifestyle Medicine, that's what it has been, more like the 20
That's
years.
the 20 years, yes.
Otherwise, the evidence has been there, and the studies have been there for a while.
And actually, Ernest, as you say that, I just remembered that even our forefathers, like the founding fathers of medicine, they actually said that the doctor of the future will not prescribe medicine, but exactly will be basically prescribing lifestyle. And even Hippocrates, as early as 400 BC, he said, let food be thy medicine and medicine be thy food. So these are things that have been recognized actually for centuries, and only just, as you're saying, becoming formalized into a school.
But we live in a very a good time. Of course, there are a lot of misconceptions, and that's why we have to demystify all the myths and stuff. But of course, it didn't deter you to understand how you may not be practicing at the moment. But whenever you saw a patient, you try to integrate the lifestyle medicine into the traditional medical practice. How difficult has it been integrating lifestyle medicine into a traditional medical practice?
So if I can think back to when I was practicing as a GP in Botswana, so as I said earlier, I did find that patients were very interested, like in lifestyle medicine. Everybody wants to say, what can I do? What can I change? Right. But then the resistance always comes in when they realize how much they have to change, right? If they want to see a big result. So for me, I would say how I manage that is I always met the patient at their level of readiness. So it's how much are you prepared to change today?
Sure.
Right? So how confident do you feel in making this change? What are the support systems around you? What are some of the barriers? If the barriers are too great, then maybe this goal is too big for now. Maybe we can scale down into a more manageable goal. But every step that you're taking, no matter how small, it's still a step in the right direction. Absolutely. So the approach then would be to say, we're not going to stop your medication at the beginning. So definitely don't go and throw all your medicine away at home. Continue taking your medicine and then make these gradual steps. And then the more of your lifestyle that you change, then the less you will need to rely on your medication. So then you will need to come back and follow up routinely, and then based on your biochemical markers and other things that we use to monitor your progress, then we'll see, okay, we can reduce your dose of insulin. Okay, we can remove one of your high blood pressure medications. Congratulations, you're no longer diabetic if you went into the really intensive lifestyle changes.
And that is very important, especially, from how we are trained. And by the way, of course, they trained out in South Africa, but if elsewhere, even the US, the same training seemed to be the case that I remember in medical school that once you're hypertensive, you're always going to be hypertensive.
Absolutely.
Once you have type 2 diabetes, we know type 1, it's insulin issues, of course. You're likely to be long-term, but even then, even type 1 diabetes, you can actually reduce the amount of insulin you take. But there is these so-called chronic diseases, and once you have it, it's going to be always the case.
Lifelong,
Now, if anything, people that are seeing this, they have to understand, no, we can change the trajectory of our life. Absolutely. Remember, if you understand the root cause of disease and be able to start changing, integrating these lifestyle practices, people will be amazed how things can start
it's so amazing,
getting better. And also, it's I'm so glad in South Africa we're having more lifestyle medicine physicians that are having practices, and that way there is help. People can, because there aren't many doctors that, unless of course your lifestyle medicine trained, that when I talk about the thing you're talking about, that to talk about lifestyle, they may say a lifestyle change, but they don't believe you can actually change and be able to be starting getting better, your blood pressure coming down a bit to a point you can actually reduce the medication. So this is very important.
Yeah, that's true. I feel like they actually see maybe lifestyle change as a want to have rather than a need to have. So it's something that we can just tack on the end of, in the last 2 seconds of the consultation, you might want to change your lifestyle, but then perhaps they don't have the tools or the knowledge to know that actually these lifestyle changes can be prescribed the same way that you prescribe drugs to a patient, so that there's this very specific formula that's tailored to that patient that they can actually follow to see the benefits.
Definitely. And I like what you said, that it's the patient dependent.
Yes.
And this is one of the contrasts
Yeah.
of traditional medicine.
Yeah.
This is lifestyle medicine. What we traditional medicine is like, oh, you have this, I tell you what you have, I tell you what to do. And somehow the patient become very passive. There's nothing actually they're doing. That's why there's this belief, oh no, I'm going to get a pill to put it in, everything going to be fine. In lifestyle medicine, the patient is the driver. We kind of assisting them to change. And that's very, very important, especially the point you raise that of course, if you people have to take their medication because if your blood pressure is 200 over 120, and by all means, they get some medication that can, work on your arteries, your vessel to be able to reduce your lower the chances of having hemorrhagic stroke. But in the meantime, they start doing something to clear that, to clear that in those atherosclerosis, making the vessels healthier. In that way, then together with the physician, you can start now reducing the medication you're taking. But it's very important that the patient shouldn't, unilaterally just stop their medication.
Yes.
It needs to be in conjunction with the doctor.
Yes. And Ernest, I think it goes back to what you mentioned earlier, that, these conditions didn't develop overnight, right?
Definitely.
So there's the way to change them is also not going to be overnight, right? The treatment. So you can't just throw your medications and then say, okay, I'm going to start eating broccoli every day and expect that immediately your blood pressure is going to go back to normal, right? It's probably going to take at least months for it to slowly go down and then, be normal. So definitely you want to emphasize that. Don't just throw away your medications.
Definitely.
Yeah.
And of course, integrating lifestyle medicine into the traditional practice, it comes with a whole set of challenges. It's I mean, both personally and professionally. I can imagine, I can think of, you find that often, number one, you need to educate the patient to understand there is no quick fix, okay? While they are used to the quick fixes, and not only that, even just you have maybe private medical setup, if it is a patient come with a high blood pressure, it's easy to renew the script and in 20-30 minutes time the patient is gone.
Absolutely.
But now if we have to really educate the patient, like you likely mentioned, you need to find where the patient are, what kind of support system do they have, and how you can now specifically adjust the prescription tailored to that patient, which takes time.
It takes time.
In that way, if you happen to have a really queue of patients coming to your practice, you are not going to finish that. So what are the challenges do you think, especially young the doctors, even the young doctors face when it comes to integrating lifestyle medicine into their practice? Because financially it's going to affect you, and also time-wise, how do you think how to deal with this?
Okay, so I think you asked a couple of questions there.
I know.
So definitely going back to that first point of what are the challenges. So as you mentioned, time is a very big one, especially as a young doctor. Early on in our careers, we just have to go, push. Mostly if you work in government, you're a queue pusher or, a ward work machine, right? So you just have to do the work and you barely get the time to talk to the patient, right? Some people don't even know, the name of the patient's spouse or basic details like that. So to find out what's your support system, what are you currently eating, what do you have available in your community, things like that. Where can you exercise? It does take time. So definitely for young doctors, time is the biggest one. There just doesn't seem to be enough time. And it seems as if the employers actually don't expect us to do that. They just want us to push the queue and to see that, the greatest number of patients in the shortest amount of time. And even working in private on your own, still you will be a slave to the time because patients get anxious outside. It's been 15-20 minutes, when am I gonna go in next? So definitely time is a big one, but I think how we can sort of target that is that just take 1 minute or 2 minutes to ask the patient what in their lifestyle do they most want to change right in this very moment. What's the one lifestyle thing? So this is something that ideally you'd be doing over multiple sessions, obviously, because you have to explain what the lifestyle principles are. And then the next session, maybe we could ask, okay, which one of these can you do? How can you start? So basically, it's at every visit, probably negotiating as well with the patient to say, okay, let's make one simple change for this visit, and then you'll carry it on at the next visit. We can review, see if we need to change, if we can increase the intensity of this change, add on other changes. So honestly, I think it takes some creativity, because if you literally don't have the time, then it does seem quite impossible. But if you have the flexibility, especially if you're in private practice, maybe you can sacrifice in the beginning and, take a little bit longer with your patients, so that in the future, you don't have to see them as often, or, you have a healthier population. And people always think that, if my patients are healthier, they're not going to come to me. That's actually false. If your patients see that what you're giving them is working, they'll actually come to you. You won't believe how many patients came to see me just because they wanted to talk.
Definitely. No, what you say is very true. It's very one may think we're preaching preaching ourselves out of this
business.
profession. Out of our business, but I think like you mentioned, once you can just sacrifice, and I think that's the way the love of medicine comes in, because really to think it, you want to make the patient better, and once that is your focus, somehow then you can have that 10 minutes just to talk to the patient, and I think. Also, the more we talk about this, I think the patients also, they start changing, understand, hey, actually we need to change. Also to often the patient, to help them understand that, what you mentioned about Thomas Edison, the doctor of the future, we interest the patient in how their physiology, how the body works, and what they can do. And to tell them, hey, actually, yes, you for now, you worried about this now, but if you take this approach, it's gonna produce results in the future exponentially. And what I always tell the patient is, often we often, I think that's how general we are. We think of ourselves. The parents, they think of themselves. But when you started seeing that as generation problem, your kids, if you don't change now, your children won't change. Invariably, that's why we have this, some of these lifestyle diseases, they go through the family. It's because the families don't change. They continue
the social context.
They continue doing what their parents did. And often what we have today, and it's a question that I wanted to ask, of course, the lifestyle medicine, how you the lifestyle related diseases, how you approach them now has changed. The common diseases are hypertension, diabetes. Now with the transformation, how lifestyle medicine can change everything. But what can you say to the patients who often they think these diseases are for the elderly people, the go-go's, and the people start getting their 40s and whatever kind of things. And the reason why I believe is these diseases are silent, especially like hypertension.
Very silent.
If you wouldn't have it checked, probably you wouldn't have been allowed
you don't
to
feel it.
The status.
You don't feel any different.
So what do you tell people who are young and healthy? They think they're young and healthy. Who they think like, oh no, I'm gonna worry about lifestyle change in my 40s. What do you say to them?
Well, I would say to them that, as we said, a journey of 1,000 miles, it begins with the first step, right? So every step that you take is a step in the direction that you want to go. So a lot of lifestyle medicine physicians will say that at every meal, every bite that you take, you're casting a vote for the future that you want to have, right? So if you think that you can sort of get away with the first 30 years or the first 40 years or something of your life, yes, it's possible when you're 40 now to change your lifestyle. You can see, you will definitely see results, right? You'll still get benefits at any stage that you change. But somebody who has been living a healthy lifestyle from a younger age will have more benefits because their body has had more time to accumulate those benefits and obviously less exposure to the things that are actually making them sick. And and it's another thing is that
Yeah.
especially as Africans, we want to we obviously believe in tradition, and we want to do things the way they've always been done.
Yes.
Right. So it's like, why should I stop eating meat? It's like, this is what we do. I can't be an African if I don't eat
I know.
meat or something like that.
Yeah.
But then the thing is, if you actually think about your ancestors, right, like pre-colonial times and everything like that, actually the lifestyle that those people lived is actually what we're preaching, right? So those are people who did a lot of manual labor, so they had a lot of physical activity. They ate predominantly plants, whole food. They definitely didn't have access to processed food. Exactly, right? And meat was wealth. You couldn't afford to eat,
they go hunt and manage to find something.
Exactly, right? So they actually ate a lot of unprocessed foods as well. They slept when the sun went down. They didn't have any other option, They believed strongly in community, right? So these are all the principles of lifestyle that we are preaching, right? So if you think that tradition is holding you back, actually think of the former tradition, the lifestyle that we were living before. So
no, definitely. I always say that in traditional medicine, which is great, it does have its role, of course, but it becomes better if you combine it with the lifestyle medicine, because otherwise it's more like we're in the trade of selling medication.
Yeah,
that's what we basically. Because that's what it is. And medical school was, if you talk about any condition, what we do to treat it. So it's more, reactive rather than proactive. And that's why often it is actually too late. So I think if people can stop and think about how their life is and understand how fragile our lives can be, and to know that really the quick fixes, they really not the way our body, our physiology, our biology is. The things happen with time, and if you just continue doing wrong things, the body can compensate that wrong, but at some point it's just gonna break.
The body keeps the score. The name of a book. Although that's on mental health, but yeah,
either way, on the point that we were saying that, of course, people can change anytime in their 40s, their 50s. But the benefit changing earlier, it's very important. There are studies that I'm sure you're aware of. This disease, they start even at early age. Talk about the streaks of atherosclerosis. Now we find in young patients, even in the children.
It's not just children. Also, there've been studies that show that actually. Yeah, the babies of pregnant mothers who have atherosclerosis also have those changes in utero. So these are children that have not even been born. They have not even made choices for themselves, but potentially the mother's choice is actually affecting them. So it's actually
and
very
that's
crazy.
How important, that's how far-reaching it is. And we'll talk about things like cancers. And of course, we have now technology that can mammogram and other thing can detect things, but by the time we even detect that, it's actually somewhat too late. We find the cancers. It is studied, by the time we see it, might have been there for 20, 30 years. But if you study a lifestyle change earlier, and then you can actually stop the progression of the cancer if you happen to have it, or to prevent it from occurring, to start in the first place. So it's really powerful. I believe people can start realizing the power of lifestyle change. But as young doctors, I think, what do you think? Do you find young doctors more receptive to lifestyle change, especially for their own health?
Look, I think a lot of doctors are receptive, as in they are interested in changing. Obviously, everybody wants to be healthy, but perhaps their struggle is they simply don't have enough time, right? So as you said, the young doctors, these are people who often have to take 24-hour calls, overnight, and then you're still expected to work for some portion of the next day as well. So obviously that's sleep deprivation, that's burnout. So you just have those cravings for the greasy food, comfort food, obviously that's diet's gone out of the window. And then now you're so tired, you don't have time for social connection, physical activity. And then a lot of doctors or other healthcare practitioners actually turn to substances as well to help them manage their stress. So the working environment currently, I must say, it's very toxic. So it's very difficult for somebody to be able to live a healthy lifestyle unless they really, intentionally make changes, which it will be very difficult. for them. But we really do need support in our workplaces. The workplace culture really does need to change to support doctors and healthcare providers in living healthier lifestyles.
So the going back to of course when you found lifestyle medicine, what was the moment, a pivotal moment or an experience, of course, understand, beside you realizing, oh my goodness, my blood pressure is actually in high ends. Was there any other pivotal moment that really cemented your experience to say, you know what, this is the way to go?
I think the pivotal moments, as I mentioned, would probably be, as I said, when one of my former classmates posted on the group. So it had been something that I was thinking about. Maybe I'd heard it in passing, and then the term lifestyle medicine got, entrenched into my subconscious somehow. But when she posted that as a tangible physical thing, that this is something we're doing in South Africa, this is how you can join and be a part of it, like join the organization and meet with like-minded individuals, get more information. I think for me that was the pivotal moment that made it more tangible for me, because before that I think I'd probably just come across the American College of Lifestyle Medicine's website in passing, but I mean it's American, it's like farts, but now this is somebody that I know that was in my class that I speak to. So it was I think that's what really brought it home for me.
Definitely. And so when talking about the power of lifestyle medicine, and I'm sure you wish that our medical school can adopt this part of it to start educating the young doctors about lifestyle medicine. What role do you think medical schools should play at the moment, seeing the overwhelming numbers of our population that are diseased?
Look, so I mean, if we think of South Africa, the context that we live in, right? We are a quadruple burden of disease, right? So that's your maternal and child death, that's your HIV and AIDS and TB, that's your violence and injury, and of course the non-communicable diseases, which we're talking about right now, right? So that's a huge burden of disease. On top of that, it's health inequities, social inequities. Like South Africa is the most inequitable country in the whole world. So that's actually very shocking. And then also things like we simply don't have enough budget to be able to take care of everyone if we continue on our current trajectory. And then now we want to introduce the National Health Insurance Scheme. So we definitely need much more affordable healthcare, right? So lifestyle medicine is something, it's one of them, right? Because I mean, it's free. Patients don't have to take as many medications, can even reduce totally, stop taking their medications altogether, right? And then it reduces the need to keep seeking healthcare, right? Because when you have diabetes and you have to keep going to the clinic every month, every 3 months, it's not just the cost of the medication, right? It's the cost of, okay, I'm missing work for this day. I need somebody to take care of my kid. I need transport money. So it's actually very expensive to be sick, especially to have a chronic disease. So if we can equip patients with these lifestyle principles, then these are things that they can do on their own at home, obviously with support and everything like that. But these are things that are tangible that patients can do to improve their health. So with that being said, honestly, lifestyle medicine is vital. It's so crucial. I think honestly it should have the same emphasis in our medical school curriculum as anatomy, physiology, anything else that you absolutely need to know to be a doctor.
Definitely. And also our medical schools that's where one will think everything, because I think the patient come to us knowing that we of course we know somewhat how the body works, and we should have best interests, their best interests, and also to know that we are advocating the really healthy living. But it's so sad that I think sometimes some doctors, they think they are Superman somehow. But like we're talking about now, we find that not only the patients, our doctors, they are living somewhat the same way. They're eating unhealthy.
Exactly.
There is this article, I think, for the name, it was actually done in Western Cape.
Yes.
Talking about
healthcare workers.
Yes. Talk about healthcare workers, how they are actually diseased. And that starts from not only when they start working, it started from even at our medical school. I mean, how can we change our cafeterians at a medical school to have more healthier options in the food that you offer at medical school?
I think it does seem to be quite a struggle because obviously cash talks, right? So money talks. So the most profitable option is what the powers that be, whoever runs the organization, whoever's in charge of contracting the caterer is going to go for, right? So I guess just fundamentally the best way to eat a healthy diet is to cook your own food and eat your own food. But I realized that this is, I mean, certainly when I was in med school, I didn't want to have anything to do with cooking my own food because with having to cook my food because I simply didn't have the time.
The time to do so, yes.
And also I lived in catered residence, so I do realize that a lot of people don't have the time to prepare foods for them to eat every single lunch. And if you live in catered res as well, you don't have the facilities, so you're forced to eat whatever they're providing you. So it would just take, in the situation that you're in, just make healthier choices, right? So when you need to select a snack, select a fruit rather than something that's in a packet, chips, biscuits, whatever. If you need to select a beverage, select water rather than any other especially sugary beverages. Even fruit juices, a lot of people think that because it's fruit it's good, right? But
100%.
Yeah, it's 100% fruit juice. It's never 100% though. There's always other ingredients there. But anyway, so when you crush the fruit and you release a lot of that glucose, so it actually ends up being very sugary, and some of that fiber gets destroyed. So if you're going to eat fruit, it's better to eat the whole fruit. Eat the normal fruit. And then opt for load up on veggies on your plate. Opt for the least processed version of the food that you can eat. So instead of going for fries, go for boiled potatoes, roast potatoes. Just try to eat food that is as close to its natural state as possible.
Yeah, but it's a challenge, and but I think if the medical school, our institution, they are on board, many things can actually change.
Yes, that's the thing.
Because not only that, I just remember, when I was in third year, one of our professor of giving us nutrition, whatever nutrition it was, could someone coming with smoking and having a can of Coke, that's kind of, type of nutrition you could imagine than what we learned from there. So it have to be, I think, the change from within the system, and also like we're mentioning, how to introduce this in the curriculum so that people can actually start learning this. And people who sell this type of food at our cafeteria, but if no one buys them, no one is going to continue to make them.
You're talking about a boycott.
They continue to make those food because people continue to wanting them.
Yeah, they're very hyper palatable. They're delicious.
And I think that's the challenge. I think of course, it's difficult to compete with this palatable food, high stimulant food, because literally they've been drained out. They're just to maximize.
They're manufactured to taste that way.
To taste that way, and also to to hijack our brain and the way we live. But the good news is, once you start changing, your palate is set to the normal setup. You start appreciating really food.
No, that's very true because in those first few days when you're no longer eating your burgers or whatever, like really highly processed food, your brain, and you're now eating like real vegetables and real food, your taste buds are like, what am I eating? What is this? This doesn't taste nice. But so they say that you kind of go through a withdrawal of sorts, but let that withdrawal take place. It'll only last for a few days. By day 4, you will probably have gotten over it, and you'll actually start to enjoy.
Definitely.
And one thing I found, that I've been trying to eat a lot of different foods that I never used to eat before. And the thing is, we always talk about acquired taste, but how do you acquire that taste, right? You have to try the food, right? If you don't like it, try it again. If you don't like it, try it again. True. So we just have to keep trying.
Definitely, And if you don't like it the first time or the second time, don't quit. There are many things that I tried the first time, second time, the third time, the fourth time. Actually, naturally, I liked it. I started liking it.
Exactly.
So, and also as a doctor, so primary our focus, of course, is how the food is going to really be the medicine for our body. That's what I focus on. I always tell my wife that, okay, we need to find if we have the key element that the body needs first. Of course, we're going to have to make food delicious, but it's secondary.
That's it, yeah.
Because, because you know, that's the way we don't. Of course, some people may differ. I eat to live.
Yes, you don't live to eat.
You know what I mean?
That's very true. That's very true.
That's very, very important. But now, just going back to hypertension, if there's someone who just been diagnosed with hypertension, he has not started medication, and what are the 3 things that you advise them to, if they can, to quit immediately? 3 things, or what are 3 things they can start doing to maybe within a year or even 6 months, be like you, how you manage to just conquer this just so simply with the lifestyle change.
Okay, so we know that hypertension has a lot to do with sodium intake, so which is salt. So actually, I don't know if people realize that probably 70% of the sodium that we actually consume comes from eating food that's been prepared outside of the home. So the biggest thing that you can do is try by all means to stop eating outside of your home.
True.
Cook your own food and then add, add salt as you're cooking if you have to add to taste. So the salt that you are adding, if you have excluded the salt that's from outside, is probably not going to be that much salt, right? So that's one thing they can do. And then you can still further reduce your salt by, using spices and herbs to give the food more flavor without using the salt as well. And then, of course, avoiding fatty food. So just your trans-saturated fats and your saturated fats. So this will be things like ultra-processed foods, anything basically that comes in a bag that you can't make at home.
And you have the names that I cannot read.
Yeah. If you can't make that home, if you can't make that at home without a lot of difficulty, then you don't want to put chips and things like that. So try to stick to your natural foods. Yeah, and then as well your sugar-sweetened beverages and your processed grains, so like your cakes and all those kinds of sweets. You really want to stop eating those. And things you should be eating is a healthy portion of fruit and vegetables. So I often find that people are eating vegetables, but not nearly enough, right? So you see that maybe somebody has 2 florets of broccoli and then that's their vegetables. So you actually need to be eating vegetables. You need to eat like 3 to 5 per day. So that's actually quite a lot. Yeah. So fruits and vegetables, they have actually minerals that help to decrease blood pressure.
Low antioxidant phytochemicals that are very that's very true. So salt is very important, like you mentioned, and also something that I learned recently. Of course, the salt, the sodium chloride that we use, there is actually an option now that is available. We can actually the potassium chloride, which avoid the whole idea of sodium becoming an issue. Of course, again, if one were to change that, you have to make sure their kidneys are working better.
Yes,
otherwise your kidneys
instead of sodium now you have potassium.
There's potassium that affect your kidneys as well. But also other thing that like you mentioned, the simple recommendation, the amazement is if people can follow what we just mentioned, it won't be only just hypertension. They will start sleeping better. The other problem that they didn't even think they had, we start actually resolving. And that's why lifestyle medicine, you cannot package it. It's not like a pill that you can take. It does not only just work on one side.
It targets so many.
It's just a holistic approach, and that's the beauty of it.
Absolutely. As you're saying, so you might think that you're making lifestyle changes to treat your hypertension, but if you're pre-diabetic, that could fall away. It reduces your risk of cancer. So many chronic conditions. By making the same lifestyle change, it impacts so many conditions. So it's almost like one pill for so many different diseases.
So Nyasha, I understand, of course, you as the interim executive president of SALMA, Southern Africa Lifestyle Medicine Association. what is Salma? If you can explain what Salma is, and what is its core, objectives?
Okay, so Ernest, as you mentioned, Salma is the South African Lifestyle Medicine Association.
Right.
So this is a national nonprofit organization. So actually, more and more countries in Africa are coming up with their own lifestyle medicine association. So Salma is the South African version of that.
Yeah.
So basically, our goal is we want to eradicate chronic diseases, and we want to do this on a national level, and of course, have a global impact as well as representing South Africa globally.
Right.
So our main goal is we want to educate our members on how they can promote lifestyle medicine interventions in their practices, and if they want to practice independently, then we assist them in becoming board certified, either through the British Society of Lifestyle Medicine or the International Board of Lifestyle Medicine and the American College of Lifestyle Medicine. So we host monthly webinars where we talk about different aspects of lifestyle medicine. We talk about the latest research. We publish a monthly newsletter, which has article recommendations, recipe recommendations, resource recommendations. We have blog posts from our executive team where they just talk about, some hot topics in lifestyle medicine, ice baths, is it good, is it bad, I don't know, those kind of things, burnout. So we have a lot of resources that are available to our members. And so we just want basically all healthcare providers in South Africa to know about lifestyle medicine, that it actually is a thing that is very beneficial, and we support them in implementing that into their practice.
Definitely, that's great. I think all the doctors actually should at least come check the website and see what it can offer.
Yes, so definitely.
I think it's they're going to learn quite a few things that can help them their health journey and also their patients.
Yeah, so definitely you can check out our website, which is salifestylemedicine.org. You can browse through. We have many different tabs. You can learn more about us, learn about how to become a member, how to become certified. And then if you're a member, you have actually access to all the webinars that we have previously held in the past. So you can just watch them on demand, claim CPD points. Yeah.
Oh, that sounds great.
Yeah.
Okay, so Nyasha, thank you so much for that, about Salma. I think it's, of course, it's still in its infancy. I think Salma just started in
2022.
2022.
2021.
2022. And I'm so glad there are a lot of resources that doctors can actually be able to take advantage of and learn a little bit more how they can change their lifestyle and also benefit their patients as well. But looking at the science that is it keeps evolving. And like we said, science in medicine, we continue to discover a lot of things that we didn't know before. How do you stay updated with the recent, research and development in lifestyle medicine?
Oh, that's a good question. I think for me right now, it's actually pretty easy. So obviously when I joined Salma last year in 2023, the main way that I was keeping up to date was as a member through watching the webinars and also reading the content in the newsletters. I'm not on social media, so I wasn't really engaging with Salma that way. But now this year, being on the executive committee, I'm actually one of the people responsible for putting out much of our social media content, blog articles, recipes, article recommendations, and the like. So obviously, before you create a post, you actually have to do a lot of research yourself into it. So researching for posts is also one of the main ways that I'm able to stay up to date as well. And since I did do my certification through the American College of Lifestyle Medicine, and I'm on the maintenance of certification pathway, so they do send you a few articles to keep up to date as well.
Yeah, definitely. Yeah. That's a great way. And the other way, of course, is to keep learning. Just like you keep checking in a scientific world, talk about nutrition and these all other aspects of lifestyle medicine. It's actually broad.
It's very
broad. You have nutrition, then you have stress management, you have physical activities. Each aspect, when you start to actually learning, you find that there are so many research that are being done at a regular basis that one can actually keep updated. And also I believe, like you mentioned, when I was speaking to Lydia the other time, also mentioned about the journal club
Yes,
that Lifestyle
absolutely.
Medicine has, Lifestyle Medicine Association has, where you critique the certain research in the
Yes.
journal,
Yes.
so that you can actually that it engages you, and also learn how you can actually be able to understand the research. Yeah, but I think it's a great thing that within South Africa, from Southern Africa Lifestyle Medicine Association, you can have a platform where you can continue to learn.
Absolutely.
And also, you do also, I think you did mention, for medical professionals, you do help them the pathway of certifying as a lifestyle medicine physician as well.
Yes. These are some of the benefits of becoming a member of Salma that you're talking about, right? So membership is free for students. So as long as you're still studying, whether it be medicine, dentistry, whatever health care related field you're studying, if you're a student, you're able to join Salma for free and reap all the membership benefits. And then if you're a professional who's qualified, then we do have an annual membership fee, which basically entitles you to a lot of the things that we already spoke about. So access to our monthly webinars where we have some very renowned speakers from all over the world. Actually, this year we've had speakers from all over the world speaking to us: Australia, the UK, the States, things like that. I'm speaking about the latest in lifestyle medicine. And then we also have a monthly newsletter, as I said, where we have blog posts, we have article recommendations, we recommend resources that you can use for yourself or your patients. And then we also have a monthly recipe as well. And then the other very important benefit of being a member of Salma is if you're a qualified practitioner or a qualified professional and you would like to practice lifestyle medicine independently, then you can become certified in lifestyle medicine. And if you're a member of Salma, you get a special membership discount from these societies.
Oh, for the exams.
Yes.
Right. That's so great. I didn't have such, privilege when I certified.
Yeah, unfortunately, neither did I.
That's actually very good. Now, we talked about a traditional medicine. Just to clarify this, when I use a traditional medicine, I was talking about conventional medicine.
Of course.
So should there be a balance? How do you balance, conventional medicine treatment with, lifestyle medicine? You might have covered that, but if you can add a little bit more on that. Okay,
absolutely. Yes, there should be a balance. So I think as you mentioned in the beginning, if you're on conventional medicine and you currently have medications that are prescribed to you, it's very important that you don't just stop your medications on your own, but you consult with a lifestyle medicine certified physician who can help you to make lifestyle changes, prescribe them to you in the appropriate dose, and then as you continue to make those changes, then you keep following up with the doctor, and then they will be able to adjust your medications as necessary. So definitely the two work together. Lifestyle medicine, as we know, we are very sure that it helps to prevent, to treat, and even to reverse conditions, but it takes time, right? It's not an instant fix. So you definitely still need to continue medications as you increase the intensity of your lifestyle changes.
Yeah, definitely. And also the point, I like the point you mentioned, Nyasha, that people, they should see, especially any lifestyle change you want to make, you should see your primary physician, your primary doctor. And there is actually, I remember reading articles how often this lifestyle change or changing how you eat, changing how you sleep, and so on, it may be taken lightly, but it actually can be powerful, especially if you are someone who's even like hypertension, talking about hypertension, and you really adopt what we call intensive lifestyle intervention. You may find that actually that it can be so powerful and profound that you may actually become hypertensive. So that's why it's very important. Yes, we don't want people just to stop their medication, but on the other side, if you go wholeheartedly with the lifestyle medicine intervention, you may need a guidance with a doctor. Otherwise, if you do that, you continue taking medication, your blood pressure can be that low.
Yeah, it can actually drop to be true though.
Yeah, it's very, very important.
That's true.
Yeah.
Yes.
Okay. So now, one of the things, of course, we talk about I mean, mainly we were talking about as the doctors and how to talk to the patients, and we trying to find where at the level where they are. But what are the challenges that you find once people are eager? You did mention that they're eager to start, and but then probably they realize how difficult or how much they have to do, they stop. So what are the key things that you find that cause them to not follow through and not compliance with the lifestyle medicine kind of intervention?
Yeah, so there's a couple of reasons why people might fall off the bandwagon, as it were, things that can end up being barriers to them progressing in the lifestyle changes. So I think the biggest one would be a lack of support. Right. So perhaps if when they started, they were highly motivated in and of themselves, they thought, I can do this by myself. And then as they go on, they realize that managing these changes on top of everything else they have to do, it's a bit too much for them to handle on their own. So if they don't have adequate social support, then it may seem that, I might as well just drop this and continue what I was doing in order to be able to survive in some cases. But other things could be perhaps maybe if their initial goal was a bit too large. I mean, yes, it's true that the bigger changes you make, the faster results or the bigger results that you will see. And in some cases, it is beneficial to make sweeping changes all at once. But normally, for most people, you'd want to make small changes bit by bit. So it might be that their initial goal was just a bit too great.
Too drastic.
Too drastic a change, exactly. And other things might be, of course, unexpected challenges that do come along the way. So if you change your diet from something that you're used to, it could be things that you don't have enough recipes. You're sort of blanking on what to eat, and then perhaps it's just easier to make the same food that you've been eating before because it's easy, it's quick, you know how to make that. These can be some of the challenges that people might face when making new changes.
And that's very true. I guess one of the advice is to take reasonable steps and also have a guidance if you have a good support system, which is very good. And also one thing that I can add is if you fall off the wagon, don't stay there. Come up again. You're still better off than someone who never starts. And to be honest, falling off the wagon is one of the steps actually in change. It's very rare that somebody would be able to make a change and then never sort of regress. And I'm into calisthenics lately, so that's what I do for physical activity. And one of the mantras sometimes is you have to regress to progress. So sometimes to be able to get to a higher goal, you have to go back a bit and then really make sure that you have your basics, you've got your foundation laid, and then you'll be able to move forward. So moving back is not always a bad thing. It's a very normal part of trying to change. Falling is not a problem as long as you don't stay there.
Just get up.
And also, what kind of resources do you find more effective in educating patients to stay motivated and also to understand their bodies and to maintain their health?
So I think the resources that are most attractive to patients are ones that are visually interesting, they're easy to follow, and they're tailored to the specific patient, right? So pamphlets that present information in colorful ways, mostly infographics rather than paragraphs of text. And if they're culturally sensitive as well, because a lot of the sort of pamphlets that we have that we use are from perhaps the American College of Lifestyle Medicine, which is great, but perhaps a lot of those foods are not foods that are traditionally consumed in our context. So just making small adaptations that are more relatable to the patient. So also that are more relatable to maybe the particular condition that the patient has. So basically, if anything is too generic, if it's boring, the patient is going to be unlikely to want to engage with the content. But if it's colorful, it's visually interesting, and it's targeted specifically to that patient's condition, then they're much more likely to be responsive to it. And it's easy to understand, of course.
That's very true. Now, talking about the resources, so Salma does specific resources. We talk about Salma and for medical professionals. For the common patients, laymen who want to learn, does Salma also cater for that? so they can come to the website, just some free materials that they can be able to get there and be educated?
So currently Salma is working, we are working on, making resources that are tailor-made to our South African population and easy to understand. Patient booklets is what we're currently working on that are going to be more helpful to the patient population. But we do also have links to, as I was mentioning before, the American College of Lifestyle Medicine, the 6 pillars, right? Which basically is like these A5 pamphlets that are colorful, and just has sort of tidbits of this is what to do, this is what to avoid for each of the 6 pillars of lifestyle medicine. So we have some resources, but we're definitely still, improving our gamut of resources. And of course, you make social media posts as well, all our social media platforms that are a bit more targeted towards the layperson. So definitely.
No, that's very true. And also at DrMuraHealth, we did some videos explaining certain
Absolutely, I've seen those.
Concepts of which people can actually enjoy on YouTube and also on our website. But it's something very, very interesting that talking about educating patients. I'm going to tell you about this. Now, this is something new. Now, I hope people can be able to see this. These, you've been making these, right?
Yes.
I think, I don't know if what your initial intention was, but I think these are very, very educating also tools, talking about how we can educate the patients and also the young kids.
Yes.
I mean, you crochet this, right?
Yes, I did make them using crochet. Actually, it's a form of crochet called amigurumi. So basically you work in the round and then you stuff the material with like just any stuffing, like polyfill or the pillow stuffing, and then you close it.
Okay.
Yeah. So I mean, it's very tactile. So it's a plushie. It's soft. So I guess for kids, it could be a very great visual tool to learn. I remember we were just talking a little bit earlier that most of the learn to cook kits for kids, it's bacon and eggs and fried stuff. You hardly see, vegetables and kind of the food that we want to promote them to be eating. So these are just so I actually initially made them for display purposes, for the lifestyle practice. And I tried to make them pretty much life-sized.
Handmade. This is very, very powerful, and I think this also itself is a resources where the more you display it, people see this, they understand what is different plant-based the plants are, the fruits and vegetables. I think you can start even engaging. Not only that, we start talking about this.
Exactly, I was about to say, it's a conversation starter.
It's a conversation.
It looks interesting. Like, what's that? And you're like, let me tell you about lifestyle medicine.
And honestly, this is very impressive. Thank you for making.
Thank you so much.
This is very powerful. Now, talking about the young doctors, I believe you're so passionate about them because you understand them. What message will you give them, like someone who just about to go to medical school or the doctors that are just qualified? What message will you tell them?
I'd say, listen, I understand your skepticism. Lifestyle medicine is something that you probably never heard of in medical school. So, of course, as doctors, I guess we are taught to be skeptical. But I would just want to clarify that lifestyle medicine is a branch of conventional medicine. And it's entirely evidence-based. We use the latest scientific research, randomized clinical trials, as I said, systematic reviews, meta-analyses, all these kinds of things. So there is so much research. There's a wealth of research that has been published that shows that lifestyle medicine has impact on nearly every chronic condition you can imagine, whether it's cancer, whether it's diabetes, whether it's hypertension. And we always stress diabetes because that's one of the conditions that has been proven time and time again to be completely reversible. I'm talking about type 2 diabetes, of course, with lifestyle intervention. So I would say, researchers, again, you can find out more about something.
And talking about the diabetes, he said in South Africa, talking about the 10 leading cause of death in South Africa, diabetes comes second. When you talk about women, diabetes is actually number 1 leading cause of death. And I think it's we're doing disservice to our patients to let them continue to believe that once a type 2 diabetic, you're always gonna be. And also, of course, depending how long you have been.
Exactly.
Probably your pancreatic cells to produce insulin has been somehow destroyed with the kind of thing. But there is a room of healing, and you may not completely even come to the reversibility.
Yes.
But you can decrease the amount of medication
that you require.
And and when you talk about this burden of lifestyle disease in South Africa specifically, that's what we know. There is a whole of number of people that we don't know who walking have this disease, but they haven't actually tested. The pre-diabetics is a big issue as well. People can just start these approaches. It can be of these long-term issues and not.
Yes. So that's very true, Ernest. As you mentioned, I was reading an article that had a very shocking stat. It said that 70% of women in South Africa over 30 years of age are either overweight or obese, and we know that obesity, overweight is one of the main drivers of diabetes. So it's no wonder that diabetes is more prevalent in women, right? So it's because of the obesity, which is obviously due to the diet and lack of activity, but also, of course, women, we know there's other hormonal factors as well. So it does tend to be multifactorial, but at the end of the day, there's always something that we can do, right? So we can target our diet, we can target our physical activity. So
Dr. Nyasha, it has been really great talking to you. And thank you so much for what you're doing. You are very inspirational for us, for all the doctors, young doctors specifically, especially. And also, I believe discovering lifestyle medicine have somehow completely changed the path that probably you're going to take.
Absolutely.
Before lifestyle medicine, what were you having in mind of doing, specializing before lifestyle medicine?
So I think my path has taken quite a bit of a turn. So obviously, when I started med school, I feel like every medical student, when we go into med school, we all want to be neurosurgeons. That's like our dream. It's not even I want to be a doctor. I want to be a neurosurgeon, right? And then you get to med school and you're like, no, I don't want to do that at all. So then for me, during medical school was always, I really loved internal medicine. I just absolutely loved the clinicians were always, so knowledgeable about any aspect, whether they were an endocrinologist, they could easily give a touch on cardiac or, they were so knowledgeable. So I really loved internal medicine. But then I realized that actually I don't like working in hospitals. I don't want to work in a hospital. And then, fast forward to graduating, internship, and then becoming a GP, I realized, hey, like, my patients actually listen to what I'm saying, even though they're not immediately changing. They really do listen. They absolutely appreciate when I ask them questions, when I ask them what they think. So I really realized that I love that engaging the patient aspect. So I realized that I want to do work that has more to do with negotiating with patients, finding out where they are, and just helping them to make life choices.
No, thank you so much.
Thank you so much.
Thank you for the work you're doing with the Salma. And,
thank you.
It's a blessing having Salma and having you. And
thank you so much.
Wish you the best.
Thank you very much.
We're going to talk soon again.
Absolutely.
Thank you very much.
Bye.